What is the difference between type 1 and type 2 diabetes? Diabetes is a chronic metabolic disorder affecting the body's ability to regulate blood glucose levels. There are two main types of diabetes, type 1 diabetes and type 2 diabetes. Although both forms of diabetes involve problems with insulin and blood glucose levels, there are several key differences between them. Type 1 diabetes. Type 1 diabetes occurs when the body's immune system mistakenly attacks and destroys the pancreatic cells, beta cells, that produce insulin, resulting in a lack of insulin. People with type 1 diabetes must take insulin injections or use an insulin pump to maintain normal blood glucose levels. Type 1 diabetes is typically diagnosed in children and young adults but can develop at any age. Type 2 diabetes. Type 2 diabetes is much more common than type 1 diabetes and occurs when the body does not produce enough insulin or does not correctly use the insulin produced. Type 2 diabetes often develops in adulthood but is becoming increasingly common in children and teenagers. People with type 2 diabetes may require oral medications, insulin injections, or changes in lifestyle and diet to help maintain their blood glucose levels. It is essential for type 2 diabetics, just as type 1 diabetics, to regularly check their blood glucose, sugar, levels using a glucometer or a continuous glucose monitor, CGM. Prevention. Type 1 diabetes cannot be prevented. In contrast, type 2 diabetes can be prevented through lifestyle modifications such as maintaining a healthy weight, eating a balanced diet, and exercising regularly. Treatment. Both types of diabetes require careful management using insulin, diet, lifestyle changes, and possibly medications. However, type 1 diabetes is treated mainly with insulin replacement, while type 2 diabetes is treated with lifestyle modifications, oral medications, and/or insulin injections. Conclusion. Type 1 and type 2 diabetes are distinct conditions with some similarities but fundamental differences. It's important to understand the differences between the two types of diabetes to ensure the best treatment options.